My name is Dan Cates. I'm a physician by training, but for the past 20 years, I've worked in the biopharmaceutical industry, and I support the research and development of new drugs. I practiced clinical medicine for 10 years as an emergency medicine physician, but then I made a career decision to move into drug research and development. I realized that while I would no longer be treating individual patients, I could still impact the lives of large numbers of patients by being part of a process that delivers new medications for unmet medical needs. Within biopharmaceutical companies, there are roles for all kinds of people, from scientists and clinicians to sales and marketing, plus numerous support roles such as lawyers, accountants, human resources, public relations, and so on. Not everybody has to come into the pharmaceutical industry from a scientific background necessarily. The specific work that I do in the biotech industry is almost exclusively done by physicians and pharmacists. I work and actually lead as the vice president in an area called medical affairs. And we are sort of the bridge between the R&D side of the company and the commercial side of the company. So my degree has worked really well. In addition to my MD degree, I supplemented with an MBA, which really helped me understand sort of the business side of what we're doing as well. So all in all, the degree I have is very much aligned with the work that I'm doing. The biopharmaceutical industry it's a tremendously satisfying career, whether you're doing the actual drug research and clinical trials, or whether you are working in a supportive role. It's incredibly rewarding to know that you're working for a company that isn't just selling consumer goods like, let's say, a cell phone or a TV or a pair of sneakers. Rather, you're a part of a team that is directly improving patients' lives by the discovery of new medicines, vaccines, and medical devices. Like any type of corporate role, it can be very competitive. The cream tends to rise to the top, as they say. And the better educated you are, the more experience you have in this particular field, and the ability to work in a group environment can't be underestimated. One other thing that I believe is a problem now is that many employees do not have adequate written and verbal communication skills. Despite a shift to electronic communications, social media, and so on, people that get ahead, in my experience, are the ones that have developed excellent writing skills and public speaking skills. We still communicate in the business world with detailed emails and written reports, as well as presentation skills using PowerPoint or a similar program. So, grammar, spelling, punctuation, and the ability to state and advocate your position and influence the thinking of others is extremely important. For physicians, pharmacists, and PhD level scientists, your academic research and clinical experience is extremely important and will determine your attractiveness to companies that are hiring. I always encourage all physicians and pharmacists to spend several years in direct patient care before they make the move into industry. For other individuals, whether that be lawyers, finance individuals, human resources, public affairs, I would encourage you to do whatever it takes to get that first role in industry. That's always the hardest one to get. But once you get your foot in the door, then you can build on that. It might mean moving somewhere that isn't your first choice for a few years, or starting in a part of the company that isn't your final destination. These are the kinds of sacrifices that you need to make early on in your career. Yeah, there are definitely career fairs. I know that certainly what we call big pharma, the very large multinational companies, will very often be on campus at various universities for career fairs. So I would certainly recommend that people engage with them there. Internships is very important. Every summer, almost every biopharmaceutical company that I know offers an internship program, and it's not at all uncommon that we will end up hiring some of these individuals the following year, let's say after they finish their education. Often we have people coming between their junior and senior years, for example, as an undergrad, and doing one of these internships. And then at the end of their senior year, a position will be available potentially for them. And certainly attending industry meetings. There are a lot of different societies and organizations within the pharmaceutical industry, and attending both the scientific meetings as well as the professional development meetings. There are a lot of resources out there and a lot of meetings that people can attend. Yeah, I mean, I spent a total of 7 years completing my undergrad in medical school at the U of A. I made lifelong connections with friends and colleagues that are still important today. I went into my residency training as a physician, very well prepared coming out of the U of A medical school program. But I've been a strong believer that as important as the school itself you attend is the effort that you put behind it. The University of Arizona gives you every resource that you need to make a network and be successful as a professional. The responsibility is on you to identify these resources and take advantage of them. I'm often amazed at how many students come onto campus, they attend class, they take their exams, but they don't avail themselves of the incredible array of career building resources that the university offers. Make sure that you're taking full advantage of everything available to you, not just as an undergrad, but as an alumnus as well.